Namaskar. Today I am taking a new lecture of forensic, that is consent. Now consent means permission for an act. So the definition of consent is it is a voluntary agreement, permission or compliance for an act by mentally sound person. Suppose he is not mentally sound, then his consent is not valid and he should be an adult person. If he is a minor, then the consent of the guardian is a must. Now we come to the types of the consent. First is the implied consent. Implied consent means suppose he goes to hospital and says, please check my BP. So he gives just verbal permission for his BP checking. Second is the express consent. Now express consent can be verbal as will be written. Now verbal again, suppose he has some injury, he goes there and he says, please give me tetanus toxoid. So that is verbal. Now written consent he gives, suppose some operation is going on, then he writes an consent form that I am willing for such and such operation at my own risk. So that is the written consent. Third comes the informed consent. Informed consent is that consent, suppose some operation or some serious procedure is going on, doctor explains every pros and cons to the patient that this may occur or these are the side effects. Even then the patient says, doctor, I am ready for my operation. That is called the informed consent. Means after informing everything by the doctor, still the patient is ready. Now the fourth recently has come is the blanket consent, which starts from A to Z as a whole consent is given, but that is not very practical till nowadays. I think you have liked my lecture. Please subscribe it.